Hello, today we're going to be talking about how virtual reality can positively impact stroke survivors.
So, a little background on virtual reality. Virtual reality is an interactive technology that creates immersive, three-dimensional environments using a VR headset. So, it basically just creates a visual setting or scenario that feels authentic to the user. It immerses users in a responsive virtual environment that reacts to their movements in real time. So, it provides feedback on visual, auditory, and sensory motor. The users participate in realistic fun activities such as rock climbing, dancing, role playing, hiking, just to make rehab more motivating and engaging. And it promotes motor relearning through repetitive task-specific practice, real-time environmental feedback, and mental imagery to improve neuroplasticity.
VR can be used in a rehab setting for many different populations. They can be used for neurological disorders such as stroke, chronic pain syndromes, and cognitive deficits. It can be implemented into stroke rehab in many different ways. One of the games I saw was chopping wood, and it required bilateral coordination, shifting your center of gravity, and balance. You could also do rowing a boat, which requires balance, shifting your center of gravity, fast movements, and the range of motion of your arms and shoulders. And the last one I saw was climbing a tree, which again requires bilateral coordination, single leg stand, and balance.
So now we're going to talk about some common settings in which you can find VR in. Specifically for CVAs, we wanted to talk about hospitals and rehabilitation centers. And this is more intervention based as a treatment method, and they also do evaluations and assessments utilizing VR. And working towards a discharge, it can specifically simulate the home environment. And then on the other end is tele-rehabilitation and home health. So this is going to be indoors at the client's home. And VR at home actually reduces anxiety due to the comfort of being at home. Specifically, if an individual may get triggered or it may become too much, they want to take the VR set off. Suddenly, they're in the comfort of their own home. It makes it a little bit easier to come back to reality. And it can also just be used as an in-home treatment method for those who cannot or do not want to leave their homes. And again, the convenience of this at home just improves consistent participation, which can then maximize client results.
So, possible limitations of VR. First, we have the cost. High quality VR systems can be expensive to purchase and maintain. You can buy sets for $200 to $400, but rehab specific VR sets that come equipped with programs designed to target the ADLs and balance and gait cost a lot more. So, limited availability may restrict use in some healthcare settings, and financial barriers can reduce the equitable access to the rehab services using VR. Client selection, clients with severe physical or cognitive impairments may be unable to safely or effectively participate in VR-based interventions. Um, Cyber sickness, so stroke survivors can experience motion sickness-like symptoms, which can be nausea, dizziness, and that during VR sessions. And these effects can decrease engagement, shorten the treatment sessions, and limit the clinical use of VR for certain clients. And then long-term carryover of cognitive improvements achieved through virtual reality rehab still remains uncertain. Improvements observed in virtual environments may not consistently translate to functional performance in real-world settings.
Now we're going to talk about the length of use that is the most beneficial for stroke patients. So, greater than 15 hours of VR intervention was associated with a significant increase in hand dexterity compared to less than 15 hours. Also, greater than 15 hours of virtual reality therapy was associated with a significant decrease in spasticity. And so that means that greater than 15 hours tends to show more significant improvements. And surprisingly, around 2 weeks to 1 month of therapy showed greater improvements in quality of life than more than 1 month of VR therapy. And as we've kind of talked about on the last slide, you might have to limit or adjust this client to client based on if they have any issues with motion sickness or other cognitive or physical impairments, and if they fully understand how to utilize this kind of technology. There are also differences in immersive versus non-immersive VR technologies, which I will talk about again in a few slides. But it was found that immersive VR, where you put on the full headset and are immersed in a 3D environment, was more effective at showing improvements in stroke patients.
All right, so now we want to talk about some evidence for VR as an intervention. So there actually is a lot of recent evidence out there exploring the strengths of VR as a way for stroke survivors to overcome their impairments. So overall, I just want to kind of talk about the overarching themes that we see here. So for supports, we just see a lot of participants that are going to see motor improvements, cognitive improvements, upper extremity function, balance, gait, upper extremity recovery, and specifically the function on the affected side, which is very, very important for getting back to daily life and maximizing participation. Key findings range from having a structured VR result in-home promoting potential greater individual gains, basically just based off of the fact that they could be in the home, as I kind of discussed earlier in the settings. They also talked about both acute and chronic phases of CVA, which is very important to recognize when your individual is in which category. And there was one study that had a control group and then a VR intervention, and significant results were seen in a bunch of these tests, which was all about hand function, manual dexterity, upper extremity function in the affected side after a stroke. And then overall, as OTs, what does this mean for us? As Kaylee kind of mentioned earlier, neuroplasticity. So we want to rewire their brain in a way that can maximize the occupational participation in those meaningful daily activities again. We also know that VR is very client-centered. As explained earlier, it can be tailored to meet the individual's unique needs and goals towards occupational participation. And then finally, talking about telehealth, it is a very big growing field of OT that we have gotten to learn about throughout the year. And a couple of the studies promoted the in-home usage of VR, where the therapist and the client could collaborate virtually, which reduces economic and social costs while also increasing client engagement and reaching those occupation-based goals.
Next, I'm going to talk about some clinical examples. So first, we're going to talk about that more effective immersive VR therapy. So an example that I found was this game called Beat Saber, which was on this specific headset called the HTC Vive. This was a music-based game where the patient would have two lightsabers in each of their hands, and they would use them to hit different cubes that were appearing based on music, and it could be tailored to many different difficulties. This was fully immersive and it could be customizable to each patient's level that they were able to complete the activity at. And it can improve upper extremity coordination, general coordination and movement, and attention or vision. A non-immersive idea for implementing this in the clinic would be using the Nintendo Switch or a Wii to do their sports games. These can improve upper extremity coordination and bilateral coordination for certain games, as well as static and dynamic balance. There are different games such as soccer, tennis, volleyball, or bowling, and the remotes provide both haptic and you get the visual feedback from a screen rather than a headset. So here are some examples of patients participating in these games.
We're going to do the food truck one first. So if you could put your hand on your eyes there. It's like so. Sit up nice and tall. So there's your order. Put bread, tomato, cheese, bread. So reach out over, grab it, stick it on the tray. And then stuff it over to your right. Use your right hand to reach. Actually, use yeah. So basically how it works is, we have this VR goggle headset, if you will. It connects with some of the sensors over there that we put on his body, and that talks to our iPad where, we can see what he's seeing in here, and he can interact with, all the virtual environments that we're putting him in to work on reaching, core strength, trunk control, coordination, all that kind of good stuff.
Awesome. And that was just a video showing our VR. So thank you so much. And these are our references.